Well, today's Sunday. I forget. Sunday the 15th of August, 2021. Um, Today is also day 26 after surgery. So, quick update. I decided not to stick with a liquid diet. Um, I went back to the soft diet, eggs. This morning I had eggs and oatmeal, and then protein shake, and then for lunch I had cottage cheese and peaches. Another protein shake, and then I had eggs. Wait, excuse me. I had a ground turkey and mashed potatoes for dinner, and then here in another hour or so, I'll probably have another protein shake, maybe some ice cream. Um, I still have symptoms, even though I was on the soft food diet, or excuse me, the liquid diet for 2 days essentially. Still had symptoms, and I was really paying attention. Like I think I mentioned in yesterday's video, water does it. Not drinking protein shakes and not really. I think today I had Gatorade and I had some calm. I'm drinking it largely calm for the magnesium, but that didn't cause nausea. But it was when I drink water, I taste it. I taste the sour. I taste the yuck, and I get the more water brash. And I think, as I mentioned, I feel like every time I drink water and any liquids, really, it just gives me extra saliva. I feel like I'm foaming at the mouth a little bit right now too, and I need to spit, or I would like to spit, and it's a little frothier, foamier than it normally is. But anyway, I I just notice it when I drink water. They get the sour taste. It's pretty disgusting, and then the water brush, and then it seems like the excessive saliva, the water brush continues to increase the amount, and then the more I swallow that water brush, that saliva, the more I get nauseous. So today I haven't really had any nausea, but I've been spitting in a spit cup. Like again, I think I mentioned before, like a somebody that's chewing tobacco. I spit it out. It makes me less nauseous. Having a few cough drops. Like I said before, they hadn't historically helped, but today's a better day. Maybe it's because I'm spitting more and I'm not swallowing as much as that of that water brush. So anyway, but I still am having symptoms. So aside from the diet, so I'm going to tell the doctors, of course, that it's the water that's the trigger. I don't notice it when I eat eggs or other food. It's just when I drink the water. Because again, yesterday and the day before, I had a liquid diet. I still had symptoms. The symptoms didn't go away. Today, I have the soft food diet, same symptoms, and I actually felt better today now that I spit things out. I suppose theoretically it could be a delayed reaction, and maybe the liquid diet was helping, and then it just took a couple days for it to help, and then now again I'll go if I stay with a soft food diet. Monday, Tuesday, Wednesday, well, the symptoms return with a vengeance. I don't know. I doubt it. But anyway, that's the problem right now. So I guess I'm going to ask the doctor about going in for another esophagram. That's what he said. I still haven't, of course, heard from the pharmacy about that medication they wanted to give me. The GI, what do you call it? The GI cocktail, lidocaine, Benadryl, and Malox. Maybe I guess fingers crossed. It is just the symptoms that I'm having are just a natural part of the process, maybe, and I'll just get back to normal here. Is it again on Tuesday? It'll be 4 weeks. It'll be 28 days. So I only have, again, 14 more days until I hit the 42, which is 6 weeks. And then thereafter, you're supposed to be able to lift what you normally would, eat what you normally would, and again, having small meals. And I'm assuming, of course, being cautious with steak or something like that. But I don't know that I'm going to even attempt to do that right away. I don't know what I'm going to do. It's weird. It's like you go from this, restricted diet then to, I'm supposed to on Tuesday be able to get noodles and rice and stuff like that. But, when do you start introducing the meats? The one diet guidebook doesn't say. So anyway, still having symptoms aside from the diet. I guess what my wife kind of said too is like, what difference does it make if you're still having symptoms and you're on this liquid diet? Then why does it make any difference? Because like I said, it was to go backwards, regress, have symptoms, but then just to have to eat the slop. Could be worse. But again, my wife, I love my wife dearly, but strangely, and anybody that would say, "Oh man, I don't really feel like tacos tonight," or "Oh, I don't really want that tonight." Something about, I can't remember what my wife said the other day about something wasn't satisfying, something like that. And I understand, when you have something you didn't like, or just you're looking forward to it, or whatever you eat, and it didn't sound good, or it didn't taste good, excuse me, and you weren't satisfied when you were done. And I found myself getting very irritated with her just because, I'm dealing with this situation right now, and I think most anything that she would have is better than what I had. The pureed chicken noodle soup and liquefied, for the most part, mashed potatoes. So anyway, just it's not good. So yeah, that's what I'm still dealing with. I'll call first thing in the morning with the doctor and ask him about the esophagram, and maybe hopefully by tomorrow evening, Monday evening at the latest, I'd have that medication I can try. I hope that doesn't make me nauseous. Something that doesn't taste good doesn't help me. It makes things worse, of course. So we'll find out how it goes tomorrow and what they say. And of course, I have two doctors to communicate with because they don't talk to each other. So tell one doctor one thing and another doctor the same thing. But I'm trying also to not tell them I talked to the other doctor, because the one nurse I had talked to seems like she is always saying, "What did Doctor So and So say?" And I tell her, and she's like, "Oh yeah, that sounds like a good idea." Like, 'cause she doesn't know the answer. She doesn't have an answer to give me, which irritates me. And it's like, at a point, if you don't know the answer, say you don't know, and that you'll ask the nurse practitioner or the surgeon or another doctor. Don't rely on the other doctor, just so you can pass off the same message, and so that you can not get in trouble. Because you could say, "Oh, I just said the same thing the other doctor said." It drives me nuts. I want your answer. And if you don't know, then ask the other doctor. Ask your boss. So I will tell them both and see what they both say and what their answers are. And of course, when it comes to the medication, I will tell them, and they will see anyway too. Of course, in my medical record, whatever, and in my medical app that I have, so they can see my medications that I'm on and such. But beyond that, I just want them to give me an answer, and maybe there's different ideas. And does one doctor want me to do this? What the other doctor want me to do that? Anyway, so I'll mention that tomorrow and see. But I'm going to continue tomorrow with the soft diet. I'll wake up and have eggs or cottage cheese, something on the diet list. So again, it just was when I went from the liquid diet to the soft diet, was able to have eggs and cottage cheese and oatmeal. It's like life changing. Seems so silly, but 15 days of that diet, of the liquid diet, is okay. I'm done. And again, going back, and it's just depressing to just not enjoy anything that you eat. So I talked about that yesterday. So what else? Other than that, I feel good. I haven't had reflux. I didn't notice I had regurgitation. For me, again, it's just the water brash, the nausea, and the sour tasting water. Those are the three primary symptoms. I occasionally get some pain, stomach, esophagus, food comes down and into the stomach, up here, the rib cage area, just below where I think is where the hernia comes up here in your chest. But that's very, very intermittent, very rare. Um, didn't have trouble eating. Again, a little bit of trouble swallowing, but again, I mean, it's fine. I mean, I feel like I can eat more. I'm just trying to be cautious. I'm just trying to be careful, and I just, but I'm anxious to move forward, you know. And again, maybe it's just again, I still have to give it a little bit more time and be patient. But um, it's just it's been hard, but today was a better day than yesterday. It's amazing what again being able to eat regular food does for your psyche, for your mental capacity, for your mental health, for your self worth, for my for every, you know, you get my point. It's life altering to be able to eat eggs and not slop, as I call it. So again, if you're just starting out, I pray for you. I hope the best for you. Those first couple of days are rough, but if you the first week, 2 weeks, depending on what diet book you get, maybe they give you a diet book that says you can have cottage cheese and some of that other stuff within the first 3 days. I just know that mine was extremely strict. So, but you know, we'll see. I guess at 6 weeks, 2 weeks from Tuesday, how I mean that's quite a few days, 14 more days, you know, to heal. But in terms of my suit, my stitches, and for the what's it called, the scope, the laparoscopic part. I mean, those still get tender on occasion and feel like they're stretching a little bit, but they don't. I don't know. They hurt. It's more like a stretching feeling, and otherwise they're fine. And I feel good too in terms of I used to have trouble rolling over in bed and was very cautious and would grab the edge of the bed and pull myself over, grab the sheet because we have my wife and I have our sheets pretty tight, so I could grab the sheet and the blanket and kind of use it as a, you know, way to pull myself and roll over. I haven't really had to do that. I mean, I feel like I have, you know, I'm able to engage my core without worrying about something will pop. So I'm anxious again. Hopefully they, you know, I can give them to give me the esophagram because it's again for me. I have anxiety. I just want to know that everything's okay. They can tell me that everything looks good, Frank. You're great. Everything's wonderful. You know, everything healed fine. Okay, at least I know I don't have to go back to another surgery. You know that they don't. Oh, you ripped or something. I've seen the videos. Like, oh, I had to do a Nissen because the TIF didn't hold or something like that. In one video, I remember seeing something about lying on the ground or lying on something far too soon and it caused the TIF not to hold. The scar tissue didn't work. And like I said, my doctor said, you really gotta baby. I had to keep repeating that. You really gotta baby it. So I've been babying it, not doing anything like that. But again, for how long? Is it 6 weeks? Is it 6 months? The hiatal hernia doc said a year. So, and then you're kind of out of the woods for it to recur. It's less likely to recur than my wife's. She had an umbilical hernia, and I think it's like hers is like a 50-50 type of a thing, I think, and a hiatal is like 85% success rate. That's pretty high, you know, I think. So that's why I'm like, hey, she has hers, but it's different. You know, she was on a couple days on some restrictions, I think, but it was more lifting. Otherwise, she could eat whatever she wanted. This is different. You know, it's a lot different. It's not the same at all. Thank God it's a hernia. No, it's not. It's not the same. Umbilical and inguinal is not a hiatal hernia repair. Um, so be aware if you're, I mean, if you're watching these series of videos, and what do I have? She's probably 14 to 24 of these videos by now, but it's not the same. So just be aware. You're gonna have a strict diet. You're gonna lose a lot of weight. Maybe in your case you need to. I don't know, or you'd like to. No offense to anybody out there that's a little heavier. And it could be a good thing for you. But for me, I know I didn't want to lose weight and I've lost significant amounts and just all that stuff I talked about before. But just be aware, you know, you're going to be on a strict diet and you can have these records and see what I had to do and what I had to eat and the struggles that I've had. Because I've seen a lot of videos that are positive, but I haven't seen a ton of negative stuff. And I haven't seen the details of day to day to day. And I don't every day, but at least, you know, this is what I had, and you know, now that I've come across the barrier, how do I get over it, and what am I dealing with? So hopefully this will be helpful for somebody out there. So anyway, I'll keep you posted. Day 27 tomorrow. My discussions with the doctor, whether via email or phone call. I already emailed one doctor, and I'm going to email tonight and call tomorrow the other one and just see what they say. Hopefully, get that GI cocktail, and try that, and go from there. Hopefully, I can get the esophagram done this coming week. I don't want to wait a couple weeks to just be suffering. And if I need something else, then fine. I mean, if they find that I do have a tear or a rip or something didn't hold, then fine. I mean, do I just wait it out and give it another 6 months to a year and deal with this right now, or do they want to go in and repair it right away? So, then do I start off on day 0 again, and I have another liquid diet? I don't know if I want to do that. Would I just wait, or am I putting myself at risk? Are they going to say you have to do this? We'll find out. So I'll keep you posted, and we'll go from there. Have a good one, everybody.